Governors in hard-hit states warn that they are facing ventilator shortages as they confront what may be the peak of this pandemic. In states like New York, Louisiana, and Michigan, doctors may soon face life and death decisions about who will get a breathing machine and who will not. Our Dr. Tara Narula shows us how hospitals all across the country are tackling the crisis.
My father was larger than life.
Jade Roth's father, former theater director Jerry Roth, lived according to his own script. But in the end, his daughter says coronavirus robbed 78-year-old Roth of his final chapter. He died of heart failure just days after his New York City hospital canceled his elective heart surgery.
When he was told the procedure was canceled, you felt like it precipitated some of his very quick decline.
Yes, I did. Now, that clearly is a subjective view. And I want to be very clear that there are always hard decisions to be made. And I don't see that there's any blame here.
Still, Jade Roth wonders what makes one life more worth saving than another. A question Indianapolis Dr. Joseph Smith hopes he never has to answer.
As a physician, it's nauseating. And just the mere idea that we would take a step back and say that one person is more likely to survive than the other, so we should provide the intensive care to the person that's more likely to survive. That is a very difficult thing.
With hospital visitations limited, New York cardiologist Evelina Graver shows us how many conversations are happening. This is Graver helping her 84-year-old patient FaceTime with his daughter for the first time since he was intubated. Just days earlier, in this video diary,
to tell them the fact that we no longer can provide the critical care that your family member may need.
Graver grapples with the new ethical questions she's facing.
I'm not God. I'm far from God. I'm just very limited in resources.
How many people per patient?
Dr. Stephen Thomas thinks physicians should not have to shoulder the burden of deciding who gets resources and who doesn't. So he helped build a triage team at SUNY Upstate Medical University to create a blueprint.
It's administrators like chief medical officers, for example, critical care physicians, infectious diseases, ethicists, spiritual leaders. They're basically getting together to try and understand, what is the objective evidence that we have that will allow us to sort of prognosticate who does or does not have a high likelihood of surviving, and trying to basically just come up with in a fair and transparent way that everyone can agree upon.
Bioethicist Scott Halpern helped write the guidelines that are being used in most Pennsylvania hospitals to decide how to fairly allocate things like ventilators and ICU beds.
Everyone gets assigned a priority from 1 through 8, where 1 is the highest priority. And then we let the supply on a given day determine how many people get those resources.
Is age a factor at all in how you prioritize people?
Age is only a factor as a last resort tiebreaker, and no other personal characteristic, be it race, gender, disability, or anything else, goes into the calculus at all.
If there was a hospital that did not have this in place, it may fall on the treating doctor to be making some of these decisions. What kind of impact might that have on that physician?
I think it would be hard to overstate the potential stress that this decision-making really requires if it falls to you at the bedside.
Because it is an impossible choice.
Yeah, it is a truly impossible choice.
And Dr. Tara Narula joins us now. Dr. Narula, good morning. It sounds like it's very clear from your piece that there are no longer good choices at these hospitals, only hard choices. And one of those choices that were that's reportedly popping up are do not resuscitate orders, universal do not resuscitate orders for coronavirus patients in some hospitals. What can you tell us about those?
Well, this is a concept that's very difficult for us to wrap our mind around, and many people think it is a little bit draconian, but really it signifies this shift from looking at the well-being of the patient in front of us to the well-being of the population at large, which is not a typical way that we're used to thinking. Essentially, what it means is if you come into an emergency room and you are COVID positive, universally the decision would be made that you are a DNR, do not resuscitate. You would not be resuscitated if you went into cardiac arrest with CPR. Now, the reason behind this is that when you perform CPR, you aerosolize a lot of droplets. It becomes very infectious and high risk for those treating the patient. The reality is that it's very unlikely that people tend to survive cardiac arrest when they're in the hospital. The survival rate's around 20%, and it requires a lot of personal protective equipment. So that's why that is being floated around. Now, the bigger issue really is that families should be having a discussion about DNR and code status and living wills and healthcare proxies now, before they ever get into a situation when they're in the hospital. It's a tough conversation, but it needs to be happening at home with families.
Yeah, you've got to think about these things beforehand, because in the moment, the crisis just engulfs you. You mentioned guidelines at a Pennsylvania hospital. Who gets the preferential treatment beyond the people you mentioned in the piece?
Right. So it's important to note that there is no set of uniform standardized guidelines in this country. And the Penn guidelines really are looking at two things. What is the chances that somebody will survive to get out of the hospital? And what are the chances that they will have a long-term lifespan survivability? And then outside of that, they're assigned that point score. If they need a tiebreaker, let's say you and I have the same score, Tony, they would look at age, and they would look at who is a healthcare provider, who is contributing to treating this epidemic or pandemic, and that person would get higher priority. Important to note that all patients get treated the same with this scoring system.
It's amazing, Dr. Narula. All the experts in the world can run through those calculations, but I don't know that they'll ever make sense to families who don't get the treatment for their loved one. Very hard choices here. Dr. Narula, thank you very much.
Absolutely.